So I'm an occupational psychologist, and I work a lot of the time with health psychologists as well. And with that work, it's very much been the case that we're looking across the system of the organisation to see, well, what can we do to help people in different roles in the organisation work together more constructively. And one of the things that we've been very interested in now for over 15 years is how we can support people to return to work, whether that is following cancer treatment, whether it's following back pain, whether it's following mental health. And one of the studies that we've been doing more recently has really been doing a deep dive into what are those factors that support mental health returns, but also sustainable returns. So too often what we see is people come back into work and then fall out of work or leave work too soon. And so this work is summarising, very top level, a number of different research studies and papers that I can share with you at the end, but that involves a number of research partners from Loughborough, from NHS Trusts, from colleagues at Birkbeck, and also the University of Sheffield. So I'll do a whiz-bang tour, and really happy to take questions as well. So what we do know, I know a number of you work in health, and maybe not so specifically in return to work, but what we know about the landscape is that there are just too many people off work at the moment. So the figures seem to be reasonably static from 2018 onwards. 1 in 3 fit notes issued for mental disorders. We also know that around 57% of lost working days is due to stress, anxiety and depression. So too many people are affected in the workplace, and more needs to be done. We also know that many people are off for too long. So the research shows that the longer people are off work, the less likely they are to return. We know from good quality data that's collected in countries such as the Netherlands that often these figures suggest that around 20% of people relapse following their return and 20% exit the workforce following an unsuccessful return. So too many people are off for too long. And what appears to happen is that there's too little support. So we know that employees are often unsure of what to say, what to do. Managers don't know what to do or how to do it, or they don't think they can afford to do it. They don't know how to make adjustments. And in our interviews with different stakeholders, what we see is that everybody thinks it's somebody else's responsibility to support the returner. Everyone has incredibly good intentions, but very little understanding of exactly what to do when. And so a lot of our work has been trying to think, how do we make this really simple? How do we use evidence-based solutions to drive practice? And this little cartoon is just a summary that we did for a project with the DWP to summarise what the manager's experience is. So managers often don't know what they're seeing in their employee when the employee is struggling with their mental health. They might see them as disengaged. They might see them as making mistakes. They might see them as not doing their job properly. They might recognise that they've not been themselves and they don't really understand what's going on. At home, the individual often feels very lost, often very unable to understand their own emotions, very much concerned about what if I lose my job, what happens about my sick pay, and so on. But also this whole confusing array of emotions and physical response to mental health. So that's the situation. And in terms of what that led us to think was that we need an integrated model of sustainable return to work so that people are supported in an integrated way. So trying to think about what lands in practice as well, what we found was that research and practice has typically been done in silos. So we in the past had done a lot of research looking at individual factors and individual strategies to support return and also the sustaining of mental health at work. We'd also done a lot of work with line managers to understand what are those behaviours that line managers need to show to keep their employees well in the workplace. And that work was sponsored by the HSE. And so we had a good understanding of what line managers needed to do. And we also have a growing understanding of what organisations need to do in terms of the policies and practices that support return. But actually that overall picture and providing that overall picture to leaders, HR professionals, to the individual is something that we didn't really see. And so we started to think, well, how do we try and put together individual factors, group factors, line manager factors? And Karina Nielsen, who's in the University of Sheffield, has been doing a lot of work over a number of years looking at this different systemic factors. And we started playing with words, and she was saying, well, actually, we could use the igloo because that looks at individual, group, leader, organisational factors. And we know also our life outside work plays a really big role. So we can bring all of that together and have a nice little acronym that helps us really think about the different factors that play a role, but also at the same time drawing on theoretical and evidence base. So this all draws from Hobsbawm's conservation of resources theory, which is this idea that we gather resources and we need resources to sustain our health and well-being, but also as they start to come together, we get these synergistic benefits. So the more resources we have, the more likely we are to thrive. And the key messaging in terms of practice is that we can't do this all on our own. So we need this protective shield. We can think of it as building blocks that we can develop and gather these different resources, both for ourselves, from our group, our colleagues, from our leader, from our organisation, to help ensure that we can stay protected and safe inside and therefore be able to do our best. So the imagery has also helped to bring those ideas together. So in terms of some of the research, we've run a number of different studies, one of which was a longitudinal study where we interviewed 40 returners and also 20 line managers, looking at, well, what predicts return over time? What are some of those strategies, those resources that people are using at each of these levels? And at the individual level, what we found to be absolutely vital is people who are likely to return and stay well at work following their return are much more likely to protect their boundaries between work and home. They create structure in their working day. They use job crafting strategies to navigate and complete the work that they feel confident and capable of doing, which boosts their self-confidence. They prioritise according to urgency and importance, and they also prioritise their self-care. So they keep up those habits, those healthy habits over time. At the group level, we found that those people that stayed well at work were much more likely to ask for feedback and have feedback provided to them in terms of how they were getting on with their job to boost their confidence, but also they were much more likely to describe colleagues offering help, and they were much more likely to take that help and say, actually, you know, sometimes I do need help when I'm doing challenging tasks. So they were receptive to that help. They also described that understanding from their colleagues, so having non-judgmental support, having people having attended webinars about mental health and what impact that has on work, helped to really foster an understanding as well. So people who had a higher level of literacy were much more likely to offer support in the workplace. At the leader level, we found that there are a number of different behaviours, but also a number of different aspects that they provided. So giving control over the way that work is done was really key. So allowing that employee the autonomy to navigate their work, providing emotional and practical support, ongoing work adjustments so that it came out over the long term, not just a couple of weeks and then forgotten about. And what was very interesting, we've written a paper that looks at 3 different line manager roles, essentially, or types of line manager. And what we saw was that line managers that were seen to be most effective often had to bend the rules to buffer against inflexible systems. And so line managers that were effective in supporting that return often did so regardless of the organisational strategies and policies that were in place. So we've been talking to HR practitioners about how we can try and reconcile that, because obviously it's not very good for the line manager to having to buffer against those inflexible systems. So pulling it out, we saw a number of different supportive behaviours around workload management, around flexible work hours, around flexible location, around conversations, and also that long-term support. But what we also have found from the line manager level is that those line managers that are successful in supporting an employee to return and stay well at work also draw on other factors. So they draw on individual characteristics, so lived experience, so they know somebody who's been through a period of challenge. It may not be a mental health challenge. It may be that they have a partner that's going through menopause. It may be that they have a child that has developmental struggles. But a lived experience of challenge was really important and really provided that factor that influenced their supportive behaviours. And also understanding the boundaries of their role. So being very clear on what they can and can't support, but being clear that they wanted to signpost support. We also saw that there are a number of organisational factors that support line managers in behaving in ways that help others. And unsurprisingly, we found that training, human resource policies were really important, but also when they had autonomy that was devolved from senior management, so where they were able to take action in a responsive way rather than having to go up and wait for things to be signed off. So we can see there both it's to do with the line manager behaviour, but also the factors that are influencing it. And then at the organisational level, the number of things that came through were particularly around providing flexible working practices and leave policies, establishing a culture where mental health and physical health are prioritised, and having timely access to health and wellbeing provision. And we also then found there were a number of factors that were outside the work environment. So where people returned successfully and stayed at work, they were much more likely to have non-judgmental support from family and friends. So another part of that igloo being firmly there. They had support to maintain their boundaries between work and home, because we all know, I'm sure many of us have habits where we pick up our phone or we answer emails or we ruminate on work. And so having people outside of work that can help you maintain those boundaries is really helpful. Having access to health and social care and charity support was something that was leveraged by many people. And also the idea that normalising mental health conditions and the discussion around mental health from the media was something that people recognised had made a big difference outside of the work environment as to how they felt able to access some of the resources that they needed. So the igloo model, I wouldn't say anything there is rocket science. Within each of the components, we can see that there's some really strong research coming through. What it does do on a practical note, though, is it helps people to identify what responsibilities they have in this return to work journey. So individuals have a responsibility to understand and take action of their own health and work needs, and also voice those needs appropriately. So a lot of the guidance that we develop, a lot of the training resources are around helping people to understand exactly what it is that they need to self-manage, but also conversation guides and exercises to practice voicing those needs so that they come out in a way that is going to lead to the change that's intended. At the group level, we know that colleagues play a vital role, so thinking about how we behave considerately towards each other, how we advocate support on an ongoing basis as well. And so our materials for groups and colleagues really focus on trying to raise awareness of what possible signs and signals and what possible supportive strategies might be. And then at the line manager, we've got the behaviour being absolutely key, but being aware of what resources that are needed. And at the organisational level, having those policies and practices in place. We've now started to do some research internationally, which is really exciting. And what we can see is all those outside resources really vary dependent on national culture and policy. So we're doing some work in Romania at the moment, and the narrative around mental health and the media coverage is so very different to here in the UK that it's much harder for people at work to have those open discussions. And so we can see that there's lots of variation, not only in policies and practice to do with sick leave and so on, but also to do with the narrative and stigma. So overall, though, we can see that it's a very individualised thing. So the igloo provides a framework within individuals can identify the key levers and resources that they need. So this is from one of our interviewees who is talking about what keeps them at work, what helps them to sustain work. And for me, it's about creating the environment where I'm able to work and function on some level, even if it's not at full capacity. It's tricky because every organisation, every person is different. I know what I need to sustain myself. I know what's important to me, and that might not fit everybody. Everyone's different, values are different, so that's really difficult. There's no definitive answer. It's just an individualised need that people have. And so really this to us brings to the fore the fact that the frameworks are quite handy, but every conversation needs to be individualised. Every approach needs to be individualised to the person returning. Just to give a quick view, we've got some practical resources that lead into checklists and behavioural guides and self-guided exercises that people can work through. But also we have a new online resource that we've developed that we're currently trialling, which is really exciting, that comes along with a coaching package, so we can see if there's a difference in terms of having online and coaching support as well. We've also applied the model into lots of different areas. So we've been looking at what are the Igloo resources for flexible working success. We did a project with the CIPD to examine the work-related factors around working with long COVID, and then producing mirrored guides so that if you're a colleague and you want to do something that's helpful, but you don't know what it is, you can just read the information tailored in a way that's useful for you. And then this is a study that we're doing at the moment, which is a multi-level RCT pilot, where we're essentially testing these resources to see whether together they make a difference. So we've run a number of trials previously looking at individual-based resources and line manager resources, and we're looking to see, well, what happens when they're all put together, and does it support people's well-being on their return to work journey? Does it reduce sick leave? And also, does it equip others involved with the knowledge, skills and confidence to support return? So finally, before we go for some questions, in terms of calls to action, I think one of the things that, and this is something that applies to practice and research, is to think about how all of the different levels of impact affect the outcomes that you're looking to measure and change. The need for multi-level interventions, which I know many of you are engaged in. My absolute passion is thinking about how we can equip managers with the knowledge and skills and confidence to support that returning employee, and also encouraging the returning employee to draw on the full range of resources that are available or should be available to them, rather than trying to do it on their own. And then the long-term goal is to support that reorientation of our systems to cope with fluctuating conditions, including our GP services, our fit note services, our absence policies, and of course SSP as well. So that's the longer term ambition, is to move the dial. And I can share the slides afterwards, but if you're interested in any of the studies that fall within the Igloo, there are references there as well. So thank you ever so much. I will stop sharing, and we've probably got 10 minutes or so for questions.
Jo, thank you very much for an excellent presentation. That was really helpful to get an overview of the work that yourself and your team have been leading on. Would invite people to kind of offer any questions or feedback. I have a question, if you like. You certainly highlighted the role of managers in terms of offering practical support to individuals in the workplace and supporting that return to work journey for individuals. I'm just wondering, is there also a role for, and you mentioned about colleagues who individuals will work with, is there a role for peer mentors, if you like, to kind of also offer practical one-to-one support to a colleague who is returning to work? And I'm just wondering if there's any risks or any dangers associated with kind of that element of support.
Absolutely, it's a really interesting an interesting idea, and I know that some organisations and some individuals will look for that as well to be in place. In terms of research, I think we found very little group level research, so I'd be really fascinated to learn of more, and it's something that is on the radar as a next step. But certainly in terms of benefits. We know that having somebody, for example, in our research with cancer patients and their return to work journey, getting through the front door was one of the most common barriers. So from the car park or the train station to the front door of the office or the work site. And so having a colleague come to meet and do the journey to work with you, meet you at the coffee shop before you go into work, all those sorts of things we know are really valuable from the research that we and others have done. So absolutely there's a place. I think there's also a number of things that we need to make sure are around that, as you mentioned, in terms of who is that buddy, what allowance do they have in their role to do that, and what is the support available for them. So I think bringing in mind the challenges that many mental first aiders have, knowing that they go into it because they want to be helpful and they want to advocate for a challenge that they've been through or they've seen others, but that then puts a personal burden on somebody who may well already be vulnerable.
Thank you very much for that. Ira, I'm going to come to you. You've got your hand up.
Yeah, Jo, thank you ever so much. That was a great talk. I've got zillions of questions, but I'm going to, Martin, others have got them. So I'm going to look at your papers for some of the definitions, which I'm interested in, but I'll look at those. But the bit, I'm an occupational physician, as you know, I've been an occupational physician for 30 odd years. You just didn't mention OH at all, and a third of workers have access to occupational health, and the mental health for the team, the OH team, this is our bread and butter. And I'm just interested that you didn't include that at all. And we know I've got 30 years of training managers and experience, and I know those that can do it and those that can't, and not every manager, no matter how much you train them, they're never going to be engaged. So they just can't do it. They haven't got the interpersonal skills. But all that information that you've got would be really, really useful for occupational health practitioners. So some of this evidence, and particularly at the individual level, I think. I mean, I think most people who are experienced in OH would do all that anyway, and would use some theory of planned behaviour to try and ensure the individual try to change their behaviours. But for people early on, I think it would be really useful to have that. You've got guidance in CIPD, but I mean, I know OH wouldn't look at that. I'm just interested because it would take.
It's really, so I would see OH at the organisational level, and I suppose it was how do I condense all this stuff to 15 minutes? And absolutely, in terms of our input to understanding organisational level provision, occupational health would be sitting in there alongside HR with different roles and responsibilities. I would say, which I know is a challenge in the broader OH conversation, often when we speak to people, they don't necessarily always signpost the support that they've had from OH, and often they get that very late in their journey, which then exacerbates that return journey and the challenges they have, because early timely support we know is really valuable. But yes, I'd love to know how, if it's useful, how this can all be disseminated to new audiences.
I'll be in touch with you separately. Thanks.
Thank you.
I think it highlights the issue, Jo, around implementation into clinical practice and what that looks like on the back of our projects. And it's something that we're absolutely keen to try and strengthen what work activities are undertaken once we complete research projects and how we get those out into practice. Martin.
Hello. Thanks, Jo. That was a great talk. Really enjoyed it. I was just wondering if you sort of knew what happened internationally. Is this a problem internationally, or is this a very UK focused model that you've developed?
It's absolutely a challenge internationally. So there are different health systems. There's a really great webinar. I don't know if any of you are members of Society of Occupational Medicine, but I joined a 30-minute webinar the other day where they were comparing and contrasting processes across the globe, and we can see that absence is a challenge globally. Mental health is a challenge globally, and managers are busy in all sectors across the world, and that's generally where people rely on their manager to navigate this process, and managers just don't have time or skills necessarily to do that. And so I think these are very, very common issues we haven't yet explored whether, what exactly are the nuances around where perhaps some systems may support strengths in different aspects of the igloo, but that's something we'd really love to do.
Okay, brilliant. Thank you very much.
And I think it's fair to say that some managers don't see this as their role either. And I think that's a tough nut to crack.
Absolutely. And I think all of the work that we've been doing is how do we make it as simple as possible with tick lists and conversation guides, so that essentially the manager can go through the motions and at the very worst be the manager that executes what's required of them. So when we've looked at 3 types of managers, there's those that really support, there are those that do what is required and the minimal, and there are those that are destructive and try and avert the process. And so my role, I feel, is always right. How do we help managers do the bare minimum when they're absolutely flooded for all sorts of other reasons, maybe not poor intent, maybe just because they are struggling as well.
Yeah. Thank you, Jo. We have 1 minute left and then I'm about to get booted out of this room. So any final comment or question? No? Jo, thank you very much. That was a fantastic presentation.
Really wonderful to meet you all, and very happy to connect afterwards as well. So thank you.
Okay, thank you very much, and nice to see some of you again. Bye.